Okay. Miigwech. So welcome back, everybody here in the room, also those joining online. So we are dealing with resolution. I'm not sure what the resolution number is, but if I can have resolution up on the screen, I'll read from the screen. I'm hoping our technical staff have a copy of this resolution. There it is. So it's resolution 2604. It's titled Support NAN to Seek Leave to Intervene in BM and Ontario to Support Off-Reserve Indigenous Children and Families. I will not read the preamble, the whereas. We'll go right down to the bottom of page 2. It reads, therefore be it resolved that NAN Chiefs and Assembly mandate NAN to seek leave to intervene in BM and Ontario. Be it further resolved that NAN will report back to Chiefs and Assembly on the progress of the proceedings. Dated at Toronto, Ontario, this, what's today? 25th day of March, 2026. The resolution is moved by Chief Lorraine Crane, Slate Falls, who is present, seconded by Chief Alex Batiste, who's also present. I thought he was Sunny. Who's Alex? But he's here. So we have the mover and the seconder. We've had considerable debate on this while we were in camera. So I don't know that it's necessary, but the rules allow for me to open it up for any comments or discussion. I don't see any. So with that, I will ask, I'll call for question and I'll ask any opposition to the resolution. Any opposition? Any abstentions? I see none. And might as well get some exercise. All in favor, raise your hand. All right, looks like it's carried by consensus. So, miigwech, thank you very much. So I'd like to turn it over to Deputy Narcisse just to wrap up this presentation.
Miigwech, Chair. And I'd just like to acknowledge you, Chiefs. Thank you very much for giving us a mandate to really intervene in the appeal process, to look at supporting our off-reserve children. And I'd like to also address those people online who I've seen the comments across our page with the importance of our members wherever they may reside. And to everyone listening online, so your chiefs, your community leaders have really stepped up and said that they are going to, support their children, their families, their youth, wherever they may reside. Because ordinarily, all of our people should be living in our communities. But for circumstances at times outside our control, due to lack of housing, employment opportunities, access to health care, our students have to leave. Those are different circumstances that are still discriminatory to many of our families. And we just witnessed that our chiefs have voted unanimously to really support those initiatives that recognize our off-reserve membership. So I really like to really acknowledge the chiefs in the circle for giving us the mandate to do that as well. As well, Chiefs, we also mentioned too the important work that's happening with the OFA. If you want, I just want to reiterate the fact that we are inviting the Chiefs, along with Chiefs of Ontario. They are doing it as well. ORC is inviting Chiefs across Ontario to come to Toronto next week to hear the very important announcement from the Canadian Human Rights Tribunal. If you wish to attend, Chiefs, and those of Chiefs online, please let us know. There's also a sign-up sheet at registration if you're interested in coming. We will be covering those expenses, so please let us know. And we are planning a media event 1 to 3 o'clock on that afternoon on Monday. So, and also with respect to the work that's happening as a result of the OFA, the implementation information sessions will still continue. I know we heard from chiefs around the circle that there's still a lot of questions and there's still a lot of opportunities to really engage with First Nations in themes of what needs to happen. We're going to work with our child and family service agencies, our band reps, all those different areas as well. So we look forward to working with you and sharing this path with you to ensure that our services to children, youth, and families are enhanced and evolve to the very distinct needs that are Anishinaabe Nation. So with that, I'd like to thank you for allowing this time to share with you, and we look forward to working with you on this very important file. Chimigwach, and I'll hand it back over to the chair.
Thank you, Deputy, for your closing comments on a very important topic. So at this time, I'd like to call upon Grand Chief Alvin Fiddler to introduce the coroner and the work ahead.
Miigwech Chiefs and Miigwech Dr. Heyer for joining us. We didn't mean to be rude by kicking you out when you got here the first time. But thank you for joining us. I can't recall exactly what year it was that I first met Dr. Heyer, but it's been a while that he was appointed as a chief coroner for the province of Ontario. And that's the guy I call whenever there is a very difficult case, or when you call me about a tragic case involving a loved one. And he always answers my call. And it doesn't matter if it's in the evening or on the weekend. He takes the time to answer the call and to have a discussion about whatever it is that we're trying to address at that particular time. But it was never like that. 10 years ago, 11 years ago, there was no relationship at all with the coroner's office and ourselves. I remember, I'm not sure if my brother Vernon Morris is here, who is now the CAO for IFNA. We traveled to Muskrat Dam about 10 years ago, and Vernon was the chief at that time. And we were talking about the coroner, the role of the coroner, and Vernon said, "Oh, are you talking about that coroner over there?" He was pointing at the street corner. There's no, we're not talking about that coroner. We're talking about the coroner. He never even had no idea. It's a good thing that Vernon's out here because I don't want to make fun of Vernon. But I think that was the case for many of us at that time. But when Dr. Heyer was appointed to be the chief coroner, he reached out right away to build a relationship with us. And there are times when I go visit a family that has lost a loved one in a community, and there are times when the coroner makes a mistake or that they overlook something. And I know that Dr. Heyer takes the time to reach out, if necessary, to apologize and to make amends and to make things right for that family. And so I want to acknowledge him and the work that he does, his office. But they've also, and that's why he's here today, they've built a unit within the office of the chief coroner called the Child and Youth Death Review and Analysis Unit. I'm not going to talk about that. He will talk about that. But they are coming to us today to have a dialogue with you to see what they can do to review the people that we lost, the death rates in the region, in the NAN territory, and to collaborate on sharing some of the data through the work that they propose to do over a 5-year period. And he will talk more about that in his presentation. And it's something some of the work is already is happening. For example, with the Steinbeck Nation. Yesterday, when I was talking about the OFA, I mentioned that the work that we do is because of our children, and that many of our children, through the system not being fully functioning, that there are gaps in their children that we lose all too often because of those gaps, and that we owe it to them to look at the whole picture and see how we can make that system stronger so that we don't lose any more of our children. And that's the work that he came to us with to propose. And I felt that it's something that the leadership of the Anishinaabe Nation needs to know about, to, first of all, hear about the proposed work, but to hopefully endorse the work that will be proposed to you by the Chief Coroner. So at this time, I want to invite Dr. Heyer to come up and explain to us the work, and to talk to you about the work that we are proposing to do on behalf of our children.
Afternoon, everybody. I don't know where Adam is so that I can tease him for teasing me when I got kicked out. Grand Chief, that was very, very, very kind words. And I was saying, there you are, Adam. You can kick out now. You go. The very kind words, and really just what we're trying to do. We're trying hard, and we recognize the difficulties that we've had in the past, and really want to make sure that we do everything that we can to hear and listen and work together in whatever way we can, even though it's always a tragedy when we're involved. I just wanted, some slides are going to come up shortly, but I wanted to acknowledge the losses that do come in your communities that we're involved with, and recognize the tragedy and the impact that that has on you as leadership, but your communities and specifically the families. And today to specifically acknowledge the tragedy that happened in KI this week, and again, another horrendous loss. And so part of the reason that I come here today to work together with you, hopefully to take the voices of those who have continued on their journey outside of this world, and take those voices and help to inform changes that maybe can be made to make things better for the next generations. Sorry, my little clicker. The discussion already has touched on tragedy, and recognize that all of the conversation today may in fact be difficult to hear, and for that I acknowledge and apologize, but important that we think through what we can learn. Also recognize that, as Grand Chief pointed out, as an organization, we haven't done well for many years, and we continue to still have areas that we need to make significant changes in, to be a system that's culturally safe, to be a system that works to share information where it should be shared, to respect traditions, cultures, practices and families and communities in many different ways. So we have a lot of work to do. And for the past, I apologize. I apologize that we have caused trauma. I apologize that we still do on occasion and circumstances cause trauma. And for that, I come here sharing that with you. But also, as Grand Chief pointed out, when there are circumstances, I want to hear about them and I want to try to rectify or make amends for those. We also recognize the importance of understanding these are your children. These are members of your community. These are not people that we own the information for. This is your information. This is information for your communities, but also your nation and broadly the territory, the NAN territory. And so how do we ensure that that information is effectively in your hands, and how do we work together to be able to understand with you what that information means and how to bring it together to help to impactfully inform others, as opposed to making it harmful, causing further difficulty, because in the past I know that we've done that by doing reports that we thought were going to be helpful, but the reports in fact were potentially harmful. So that's why we are pausing and taking our time to think through how to do this work and coming today to see you. We really recognize how important children and youth are in all societies, but particularly in your society, in your communities. And we want to reflect on that sacredness, and we want to acknowledge the real privilege, sadly, in tragic circumstances, to learn from the losses that have occurred, to really help to improve things for the future. That's what we want to do, and that's what we're hoping to do together with you. So as Grand Chief talked about it, we do have a unit. Four of the members are here. 4 of the 5 members are here today in the observing. They got kicked out with me too, Adam. And they bring a variety of skills and knowledge to the team to help to work together, specifically in the areas of deaths of children and youth, to investigate, understand the circumstances, and bring those learnings forward to try to enhance public safety, enhance systems, and if possible, prevent further deaths. They really are complementary or a part of supporting the work that the coroner starts. And Grand Chief, we have had coroners now attending for the past year and a half in Lion communities where we never attended before. And your comment was well, it was a joke. It was real. It was real. People met the coroners that came with Anishinaabe Police Service, and the community said, "That's what a coroner looks like." And it was accurate. It's kind of sadly funny, but totally accurate. And then I can riff off your story, and say that my office is the coroner's corner. So there you go. You can use that one now too. Because I have a big Western colonial office in our facility, but it's now got a bundle in it and a number of other wonderful things that help me to be grounded. So what the CIDRI unit is doing is really to understand the factors that may have contributed to individual deaths, but also understand about where are there systemic issues and structural issues that may be identified by looking at those deaths together, individually, but also together. And we have heard that our processes really have not understood the context, not understood the why First Nations are disproportionately impacted especially in the losses, but within the child welfare system. We know the tragedies that have occurred and the difficulties that have occurred with intergenerational trauma and 6D scoop and residential school death investigation and missing and murder Indigenous women and girls. All of those impacting, but we used to have a group of experts in Toronto that sat around with no First Nations representative, and they were opining on what the systems issues were. Well, we stopped that about 5-6 years ago, but we're still on a journey of figuring out how to do this in a more informed and a more collaborative way. But we have made strides, but as I say, we've got more strides to do. So our processes are working to be transformed, but we have, as I say, more to do. But really, how do we do that collaboratively to help the unit work forward, but then more generally, our organization? Specifically to the circumstances of children, youth dying tragically in NAN territory, that really is the focus of our conversation today. And it's those who really have, where we've seen difficulty with services and intersections with services, and it continues to be a serious and an ongoing situation with a number of tragedies occurring. And it's thinking about that work together. Where we get the information is from Indigenous child well-being organizations. When they're reporting after the death, they've intersected with those organizations. We also get those from work through the coroner's investigation and the police investigation at times, and at other times we may get other records like health records. But trying to take that information, early review and early evaluation has been done by the team, where they've looked at factors that really may be impactful. So including identity factors and those where there's been challenges that the children and youth and the family may have faced prior to their death, and trying to have an understanding of that, both again at the individual, but more together. When you look at a number of the children together, it may illustrate a systemic issue. The teams also tried to document where systems intersecting didn't do it effectively, as Grand Chief talked about, and also where service inequities are present that may have impacted their journey and trajectory to the loss. The next slide talks about the number of losses, and so I comment on that ahead of time and recognize the significance of this number. Between the period of 2019 and 2024, we have been involved to investigate 62 children and youth from your territory. That's a tremendously large number. And these are all young people. And I can only imagine the impact on your community on an individual level, but when it occurs on more than one occasion or an ongoing basis, I can only imagine. Of the children and youth that passed, the majority, or sorry, the highest number were between age 15 and 19. So very young people in the early stages of their lives. And 60% were girls, identified as girls. 50% of those children died by suicide. And the challenges that we've observed in our early evaluation, which is information that's still within our organization and we haven't shared publicly, or do we plan to share publicly without your perspective and your guidance and your permission, is the common challenges: suicidal ideation, interpersonal, intimate partner violence exposure, physical or sexual abuse, substance use, all experienced by those children and youth. About 70% or over 70% had challenges with their living conditions, including what would be described as unsafe housing, overcrowding, financial difficulties, all that contributed to their living conditions. So from that early information, and I believe there's a resolution before you, we're seeking guidance on how we can work together collaboratively with Anishinaabe Nation to best evaluate, report, and share the information that we have with you, and think about how can we understand it and learn from that to be part of the collective story of the strength and resilience of the youth, of your communities, of your nations, of your territory, that we can act upon that to help to improve the health and social condition for NAN members. So how do we translate the information that we have, or how do we bring that information forward in a meaningful way with you to help to impact things like you were talking about before I left, as far as child welfare and the organizations and the work that you're going to be doing on that. How does it help with the health, potential health transformation that you're leading and taking on? Our intent is continued, as I've talked about, is really how do we help to contribute to the improvement of the health and prevention of death, but at the same time, by minimizing harm. So we don't want to focus on a community and point out all the bad. We want to focus on the community to find the resilience and the strength and focus on that community and what's occurred in that community to bring those voices in a positive way, even though tragic, in a positive way to help to inform improvements and changes. We do want to hear thoughts. I want to work together to hear from you and think about what to do. And we really are recognizing and embracing the importance of working together, and with your guidance, I want to work together in a good way. So I'm going to open up, Grand Chief, for questions, I presume. And I welcome any questions or comments, and hopefully that was informative and understandable.
So thank you, Dr. Heyer, for your presentation to the delegation. So the floor is open for any questions, and we'll get right into the resolution. We'll also have an opportunity to clarify any of the topics that were so the floor is open. Okay.
Yeah, good afternoon and welcome. And thank you for your presentation. I think, we need to go beyond youth and child and go to, the adolescence of, I lost 6 in a very short while due to drug issues. The problem I have is that, I've asked for toxicology on the deceased to know what really, caused the death. And to date, I have had 0 response. So the issue is that, and the lack of policing. If I do get to the reports that, the cause of death was through fentanyl, and if we knew the police are, charging people, or at least knowing that they are selling fentanyl, then they would be charged for manslaughter. But the communication between is non-existent. So people walk knowing full well they sold drugs that were lethal. And I'm talking about young ladies here. One of them had 4 children. She died of an overdose. My niece died of an overdose. And we've been telling the police, these are trap houses where they sell this shit. Pardon the language. But it gets so frustrating when you're a leader of the community and you're being told by membership, solve the problem. But how can you solve a problem when there's nothing there to go by? My nephew died a few years ago. Again, we had asked for toxicology. Nothing came. So there's absolutely nothing that we can do at this point without having to point fingers to say this is where it came from. Somebody here is dropping the ball, and we're losing our members because of that. So I see what you're doing here, and I appreciate that very much. But there has to be a little bit more. The root causes of why these things happen. And how can we do, what can we do to prevent this from happening? I'm telling you, I've given our police officers a smoking gun, and yet they can't even go into a house to investigate that these guys are selling. We have proof that the transaction guy selling fentanyl, and they say that's not enough proof. So what is? You know, we can learn what you're saying from a death. But what I'm trying to say is to prevent that. I want you to retire, to lose your job.
I
So
do-
you
I
don't
do
have
too.
to. That's where I'm getting. We're always reacting to things after the fact, after somebody dies. But what can we do collectively from your office, maybe Solicitor General's office, and others that we can, go and say, yeah, okay, these are the problems, these are the cause of death, and these are the culprits that are selling that. And these guys come from, not from the community, they bring the garbage from here, Toronto, Mississauga, and all surrounding it. So again, to me, yeah, I hear what you're saying. Let's work on, okay, the issues why this happens. But let's not let this happen. Let's be a little more, preventative on how we can, keep our youth, children, and our young mothers and fathers alive. So I think we need to explore a little broader way of doing what this is saying. This is telling me, let's do this after the fact. What can we learn after somebody dies? It's good to know, to be work on something preventative. But again, it's after the fact. And to me, that's a little too late for, 4 of my young boys that their mom left a little too early. This is this last week. We buried her. Left four little boys. And she was 8 months pregnant. And she died with the baby in her stomach. So that, again, it hits home. But we need to do something a little more proactive with all agencies involved that do what they need to do, but they're not actually doing it. You do your job because it's there. The person has died. But to prevent a person from dying is something that we really need to focus on. So with that, I thank you for what you do, and I am listening. Thanks.
Miigwech, for your words, and I'm so sorry for the tragedies and the ongoing nature of them. A couple things. Number one, I'm going to give you my card, and we're going to find out what's going on with that toxicology. We'll do it. So that's number one. Number two, the last point on the resolution, I had a chance to quickly look at this, is what we're thinking about is that the child and youth is the initial area that we would work on, but that will develop a process for understanding different types of death. So then that could be, we'll develop a relationship that has the sharing of information, that has the working together, that you just phone whoever on our team and we say, you didn't get the toxicology, you need to have it, but let's look at drug-related deaths in your community and have the same kind of data sharing approach, the same kind of collaboration. And then we come with you. Again, it's always after that we're involved. And your point is so right on that, and it's terrible. We come with you though, and then we collaborate and we bring together a meeting of those who are responding. And we say, look, this is the information that we're seeing from Ireland. What are your thoughts? What more do you need from us? Because we don't want these tragedies to keep happening. So that's where I see us developing the collaborative relationship, that we're together. We're walking together to share this information. And I bring people in, you bring people in, and we have that meeting, and that way to share. So that's the way I see us incrementally doing the work and figuring out how we do it in a way. But right now, we don't have to wait. Ireland and the chief coroner don't have to wait. We can go ahead and get started in thinking about that specifically. I've been involved in other nations who have asked us to do this, and we've done it. And we will work together in the way that we've just talked about, because it is tragic. I don't know if we have the answers, but that doesn't mean we don't try to find the answers, and we don't try to bring other people in to bring those answers and understand the tragedy in a way that's showing more than one circumstance and how there's similar patterns. Trap houses are an example. There's similar patterns, right? So how are people going to approach these things differently? So, Miigwech, for your words.
Okay, thank you, Doctor. So we're gonna go to Chief Wabas, Chief Kuzis, and Chief Nakoji. Pintam. Pintam Archie. Yeah.
Um, I thank you for the presentation. And I also, I understand, what you're presenting. What you're presenting is the deaths of, the children and the cause of death, that we're trying to, pinpoint or determine. That's after the fact, right? After the fact. I don't know if you're referring to historical deaths or the future deaths. The former speaker, Chief Ireland, I think before that happens, he's talking about prevention efforts. We're gonna have to look at our families, the condition that we're in, we may be in barbarous condition. And that could be the leading causes of, pains and problems, everything. Prevention efforts should focus on identifying the living condition, the environment, the services, lack thereof, and things like that. So if we could try to prevent death of a child, I think that would be a good thing to pursue. And if we're just waiting for deaths to happen and analyze them after the fact, will that bring justice to the families? I don't know. I don't think so. We're just going to continue, open their wounds if we start asking them what the child history and what was this child about? It's going to bring it's going to bring anxiety to the family, of course. So how after that, your office is going to provide us some recommendations. I don't know, like I would have to ask my people if they want to get their child when a child dies, they go to autopsy or something, and sometimes the autopsy is like 2 weeks till we do our funeral, and the anxiety, stress, and the hurt, the pain of that family is prolonged. That's another issue that we have. So I would focus on prevention efforts, like based on the historical deaths of children. Okay, what condition are we in right now that may have contributed the death of a child? Yeah, thank you. Because
Miigwech, that's what we want to do with you, is the tragedies that have occurred, not likely to go back and talk to the families to open them back up, because doesn't mean that they won't have information, but we want to be very careful to not cause more harm that's already been caused. But we have a lot of information that was gained through the investigation. So we want to show people where the issues are and say, this is where you should be preventing things. So we want to stop deaths, obviously, but it's taking that information from before. So thank you for your words. That is what we want to do, but we want to do it in a way that you're describing, which is not our way. So it's not that we're going to make recommendations, because I'm a privileged guy that grew up in Toronto. I've visited many of your communities. I've heard from many of you, but I haven't experienced what you've experienced. I'm hearing about it and I'm trying my best to learn as much as I can, but we're not the people that know. That's why we want to work together. We have the information, but by working with you and your communities, then we can translate that, not translate's the wrong word. We can bring that information together in a meaningful way, in a respectful way that doesn't cause harm at all in any way that we can. We can never guarantee that, obviously, because we're talking about terrible things, but that's what we want to do. And then we would work with you. It's not that we're going to develop recommendations, because great, I tell you what to do. Do I really know? You should have some idea, but you're going to be able to tell us. And so the question may be, we may not make recommendations. It may be that this is information that is, we work together to determine what information we have. And that may be then the leadership has that to inform prevention efforts, and has that to inform other government organizations, has that to inform services. So that's the approach that we want to take together with you.
Thank you, Doctor. So, Chief Gary Kuzis, then we're going to go to Robert Nakachi, and then Carla. Is that right? Okay, and Liam, okay, and then Deputy Grand Chief, and then Lorraine. And Vincent.
Okay, Miigwech, Chief Kuzis from Niskandaga First Nation. Thank you there, Doctor, for your presentation. I got a couple things here. One of them, we have a state of emergency that's still in place due to suicides, and there's no answers for it. And the other one is the deceased. I want to talk about the deceased. You know, a lot of times our deceased are sent to Toronto, and it takes probably 2 weeks, 3 weeks sometimes, and it really impacts our culture. You know, we never fly people that deceased in our culture a long time ago. Now today, if somebody dies, you fly to Toronto. And a lot of times, people wait another 6 months or a year to have that closure. How could we improve this? You know, like the Thunder Bay is a hub for our region, and there should be a place for that. You know, this is very, that's one of the biggest trauma we have. You know, even a baby and anybody that dies comes here to Toronto. And that shouldn't happen. And I think that's one of them that has to be fixed. You know, others talk about the prevention. Everybody has to get involved in that. And the justice system has to be corrected. Right now, it's failing everybody, including us. You know, people that are on a justice system are failing. You know, that has to be reviewed, because we can't keep having like this. You know, it's one of the things I like to see improved of the deceased. You know, and closures. A lot of families are still waiting. Probably a few years already, you know, because nobody comes up and say, can you find out about this? Because nobody wants to open their own, right? So that's one of the things I want to bring up. So Miigwech.
Miigwech for those comments, and thank you for sharing them as well. A few thoughts. In January, we made a decision, well, I made a decision that coroners are responsible for determining if somebody has First Nations identity or other racial background. And within that, if the person is found to be First Nations in and outside of community, then they must report to the chief of that death. So we are sharing that now. It started to be shared with chiefs for all, so you have an awareness of one of your community members. If it's an outside community member in your nations, you would typically know. I know because you're there. But outside, we're doing that. So that's number one. So there's the ability to know what's happening. Number two, from Thunder Bay perspective, we provide some service, but woefully inadequate. 1 week a month. There is pathologists that travel from Toronto. I don't know this is factual and guaranteed, but there are 2 forensic pathologists that are in their year of training right now from the Northern School of Medicine who want to go to Thunder Bay. So there we would increase our services in Thunder Bay to eliminate or reduce the number of transfers. But we know this is a significant problem. We're also advocating with the government to have a facility built. Again, that's outside of my hands a little bit, but that doesn't mean that I don't keep talking about it and telling the government how important this is. We in Toronto respond to cultural requests of different and traditional requests of different communities. We should be doing exactly the same in the North. And so I hear you. I don't have all the answers. It is something that's top of mind for me, and I'm regularly having these conversations within the government to do it. And I'm hoping that if those 2 forensic pathologists do go back, many, many, many more still would, for the shorter term, for the next little while, we would be transferring any complex circumstances where there might be, because in Toronto we have a CAT scan, we have special testing processes. We want to make sure we provide the best opportunity for the examination, but there's many that could very effectively and very thoroughly be examined in Thunder Bay. So we hear you loudly. Thank you for those.
Thank you. So we're going to go to Chief Nakaji, and then Chief Carla, and Chief Taylor in that order.
Hello. It's Chief Robert. Good afternoon and thank you. It's alarming from having the numbers and seeing from 2019 to 2024. What I'm curious regarding the 62 deaths is how many of them are on reserve and some live in urban cities.
I think
That would
My-
be page 5.
my recollection is, I have an additional chart that I didn't put forward because it's so, anyways, it's very data. My recollection is that these are all from community. I'm looking to the team, not all from community. There are, do you know the numbers? Yeah, but the majority are in community. Yeah, not all of them, but we can find that number for you, but the majority are in community.
Okay, and the follow-up question to that is, I think this is where we need to advocate more on our services regarding, because I don't know, it's 50% is still suicide. Suicide? And I think, yeah, and the numbers, 50% of 15-year-old to 19-year-olds being suicide.
Yes.
That is alarming as well. And I think it'll be important we do more as nations to address that. That's and this is something where I think we also need to look at is um, what's the root cause of our children going through that? I just say that I have two young children. Young, they're not young, but they look, but I have children too, and just finding out the root cause, because what we don't really talk about as much is what I am assuming some of them might be going through is regarding sexual abuse. And I think we need to really start discussing it and addressing that heavy topic. Thank you.
Which, and yes, this is the approach that we've considered, which is we do have an idea of those circumstances based upon the information that's available to us right now. But we want to think about how do we look and evaluate, and are the factors that we're evaluating in our death situation, in our organization, are they the factors that, as you're talking about, are they the factors that are important? They're all important. Are they the factors that are most prominent? And so being able to hear and work together, we will think about how do we do that analysis to be able to identify the trends and themes and underlying circumstances and how often they happen within, and how does that align, for lack of a better term, and I'm not sure it's the right term, how do those associated with the history of challenges that have happened from residential schools through the trauma that occurs, the intergenerational trauma, how does that intersect with 60 scoop and the challenges that occur after that? How does that intersect with the child welfare system that's the colonial child welfare system, as opposed to what's happened, the health system? So it's thinking about the journey that your nations have been on with terrible challenges. Where do the factors that we're seeing with the kids, the children and youth, how do the two align and illustrate about really factually, again, terrible word, but the true challenges and systems that we've seen that really illustrate what is known to all of you, and how can that information be brought together from us and you to those that are in a position that need to lead these changes or support you in the changes. That's the work we're trying to think about how to do in the most effective way. And it's not about us, back to the question that you said, it's not about us writing a report and saying in First Nation such and such, and we think First Nation should be better. Well, that's just dumb, right? And we shouldn't be doing that. We've done that though. We've done that. We shouldn't be doing that. So how do we do it together with you and hear about your perspectives and where are the areas we should be looking at to help to unfortunately raise some very challenging conversations that may occur, but it's together to think about how to do that. Not that we're going to be the experts, not that you're going to be the experts, but together we can be stronger. I think I'm being a bit self-congratulatory here by saying that we would be better, but I think we would be.
Okay, thank you. So I'm going to go to Chief Carla, then Chief Sherry, and then Chief Lorraine, and Chief Benson, Deputy Grand Chief Annabette, and Archie.
And we're bringing dinner in.
I think it's really important to give that opportunity to speak on something so important. So I am mindful that, time, but also we're talking about something very, very important. And I think it's important to have that voice. So as chiefs, to give that voice to the coroner who is asking for permission to do this very important work. Okay, Carla.
Hi, good afternoon. My name is Carla Duncan, Chief Muskrat Dam. Thank you for the information and of what you presented. This is not a question for you or for you to answer, but I just wanted to share what I've been sharing. I've been sharing to different groups. And this is exactly what I've been talking about, how we're losing our children, and not just girls, it's boys. And I'm only speaking for myself. Like I was raised in my community of Muskrat Dam, and this is the reason why I selected that checkbox to run for chief. I did not want to lose any more people. I just kept seeing it going and going to our great grandchildren. That's how I saw it. We're losing our children, like, and the core issue was sexual abuse. And it's still going on in our communities. Like, I've been visiting different communities too, and like for me, growing up, like it's like we were sexualized, we were sexual abused, sexually molested, like different by different people, by different settings. And so as I was growing up, I was fortunate to have my mother, my late mother, and my older sisters. They taught me to always speak up for myself, to always, I was literally kicking people. So, and then today, so I went on, when I go to some reserves, especially our far north, I can only speak for our far north remote area where I'm from. I'm not familiar with, where Sherry's from and the Moose Cree area, but the communities that I was visiting, that how it was normalized, how people were talking to each other, even like leaders, men, women, all different ages, how they were speaking to each other. It was sexualized and how they were normalizing it all. And our children hear that. And so they're like 10-year-olds, 11-year-olds are dating. And that's the common age that that people start going into substance abuse and then, continuing that cycle. And most times we lose them to death, many of those people that are going into that cycle. And, the young women in my community now, when I went to those other communities, we went with some of them to the young women that were about 20 or younger. They were like, why are they talking like that? So, like, if they are talked to in Muskrat Dam now, how some of those other communities are talking to each other, like sexualizing, normalizing, they would say, don't talk to me like that. So I'm so proud of that we've grown from that. So like I'm just leaving this message to our communities, like we have to stop doing that. We have to teach our children, because that's where it's stemming from. Like they don't care. They don't care about economic development, once they get, if they've been harmed and then they get older and then most of them will go into substance abuse, addictions. And then they don't care about economic development. They don't care about mining or protecting our lands or even their own health. Like they just get sick and we lose them to death. And, like it has to be us. It has to be your roles. It comes from our level to make that change. And like I have many people that treat me with respect, but there's also, like for women and children in our area, and even to men, there's lots of sexual abuse because of, from ever since contact. And it just stems from that, residential school, Ralph Rowe, it's all connected from that. And, all these determinants of our well-being, that's where it's stemming from. So I just wanted to give that message. I don't expect you to answer, but I'm just sharing that. And because it's still very, it's today's issues in our communities that where I'm from. I can't speak for the other communities because I'm not familiar, but I just wanted to share that because it's coming from your report, all these statistics that you have. I was just reading it, so thank you.
Miigwech, and I know you didn't ask me to respond, but miigwech for that. And it does make sense and we see similar patterns. Miigwech.
Thank you. So I'm going to go to Chief Taylor and then Chief Crane, then Chief Benson.
Okay. Good afternoon. Sherry Taylor, Ogomakwe, Ganugaming First Nation. I just want to say thank you, Chief Carla, for being so open and transparent. It's part of the, our responsibility as leaders. And I just like to say thank you for that. I also want to thank you, Doctor, for using your privilege, as you said, to make change. You know, those stats you've provided to us, 4 of those come from my community. We know that there's a lot of intergenerational traumas in our community. It's alarming rates. We are losing our kids. And yet still today, there are systemic issues in the systems that are supposed to be there to help us. So how can this data, this information that you have, it should be there to change those things for our kids. Still today, my children at home are being refused care. I've been advocating for them to get mental health support for suicide, for mental health, and they are refused care from the hospitals in our area, regional hospital in Thunder Bay. They are signing discharge papers of our kids saying that they are acting when they should be getting the help. They are being sent home. So not only hospitals, there's police, there's ambulatory services, education, schools. My community is road access. Our children attend schools and other places where we have to bus them every day. There's still a lot of ignorance. There is still a lot of work that needs to be done. And I, for one, will try hard not to allow any more of my children to be lost. And that is where we need more help from people like yourself that have the ear to those people that make those policies and make those that can make the changes that we need to see. So that's what my message is to you. Yes, we do need that help. How can we get that help in those places that we depend on to get the help that we need for our kids? Semigwech, for you being here. It is not easy to talk about this. Very sacred to us. I say thank you. Thank you to elders here. Rich.
Thank you, Chief Taylor. So I'm gonna go now to Chief Lorraine. I didn't know if you wanted to make a response. Okay, Chief Lorraine, and then right after that, we're gonna go to Chief Benson, then Deputy Grand Chief.
Hello. Lorraine Crane from Slate Falls. I put in a lot of thought over all this stuff before I saw your presentation. We have a lot of troubled youth in our communities. Some very young. we don't have enough services. We have some mental health counselors that come and go, but they're not there. Maybe 2 weeks in, 2 weeks out. And the children really, really, I notice they go to these workers. Sometimes it's because they don't have anybody. They don't feel safe to share what they're dealing with, what they're feeling. And I notice you have housing, overcrowding, financial difficulties. There's so much more. There's so much more that goes in here. What are the causes? What are the children? What are they dealing with? The youth, what are they dealing with? I added addictions, family disconnections, people splitting up, moving, children left behind, back and forth. Kids that are left orphans. And the law, they just get in trouble, they start young, getting in trouble. So there's all kinds of stuff that goes in here. There's so much more, like I probably could write. I'm a survivor myself of many, many things. I lived a very sheltered young life when I was a child. Up to age 7. I had my mom, my dad was raised on the land in a log cabin. I was safe. I know what it's like to not feel safe when you're a child. Right until I left home, I know what it's like not to be safe. So I just wanted to say that, we have to reconnect our families. We have to bring back what we had. And it's the connections that really make a difference in a family. I lost a nephew at 17 years old to suicide. To this day, my sisters and I and our children, we haven't figured it out because we don't know how to deal with it. So that's why I'm saying, within a family, I think that what really gives a child a chance is that the connection that they have with a caregiver. There's so much, and I thank you for your presentation, your numbers and your numbers, it 2019 to 2024. I just wonder, how did you decide where did you decide to, when did you start counting? It's caused me a lot of pain just to think about that. Back in the day when I was in the system, I don't recall where this ideation came in. A lot of us went through the system. I was in residential school, and I'm a product of many things, but I survived.
And I just wanted to share one more thing. One of my elders asked me recently, "What's happening to our people?" She said, "Why are they sending people to Toronto now?" Like, I didn't know what to say to her, and she meant autopsies. That's what she was talking about. She said, that never used to happen to our people," she said. Mia.
Thank you, Chief.
In which I think you've illustrated or described one of the challenges that we have is what should we be evaluating in these tragedies? And so you've given me some more examples is the wrong word again, some more factors that are important to understand to be able to inform the strategies to make things better for the kids. And so thank you for that, Miigwech, for that. Totally, we provided 5 years. We do have the numbers otherwise, but we thought 5 years was the most recent, and that was what we did from the analysis perspective for now. Miigwech.
Okay, so we do have 4 more speakers. We're gonna go to Chief Benson, and then we'd like to get to the resolution, which gives the mandate. If this is the work that you want to proceed, and from what I'm hearing, this is very important. Facts that can help move some of the things that in the community that contribute to children, losing our children. So Chief Benson, and then we're gonna go to Deputy Grand Chief Annabette, and then Chief Wabash and Chief Dolores.
Thank you very much. My name is Cornelius Benson from North Caribou, Round Lake, Uyagamo. So I thank you for your time to make your presentation to us. Thank you. But I'm going to try and say what I've been thinking. I'm mainly going to speak on the communities from the northern point of view. We have, as you're talking, you said that there's some way that we can help. There's some way. That's what you said at the beginning of your presentation. Yes, there is. Perhaps when I think about my community, we have a year-round road that comes into our community. And since it started, we have been using checkpoint where people go through the gate coming in. And we have people stationed there to try and control what's coming in to our community, like alcohol and drugs. And it has helped. In some way, it has helped. And also at the airport in our community, we have people that work there that search the luggages for contraband that comes in. What I'm going with this is that my band has been using their own funds to do this, to helping ourselves with this. So far, I haven't known any government funding to help us do this. It comes from our own panels. So where I'm going with this is, maybe there's a way you can help us. Maybe you can recommend to the government that they can fund us for trying to help our communities. I'm talking about other communities up north. maybe there's a way that you can help us with putting our word in our proposals that we really need funding for this kind of program we're running. Like I said, it does help. It does help. Like every community, I see a rise in addictions, drug addictions. And we're doing our best to hire people to be at the gates and be at the airport. We try and look for funding ourselves from our budgets. So I think with your recommendation to the government, maybe they would think about it, consider what I'm requesting for other communities. Thank you very much for listening.
Which,
So now we're gonna go to Deputy Grand Chief Annabette, and then right after that, we're gonna go to Chief Archie, Chief Dolores, and to Chief Sylvia online.
Chairman, first of all, I want to acknowledge all the comments and what has been shared so far since Dr. Heyer asked for some feedback and comments. Within the last 20 years, there have been other inquests and reports that have been talked about our children. You know, we had the Pekanjagam review on suicide. We had in 2022, there was a report that was released by the coroner on children that died while they were in care of a child and family service agency. And those, triggered some resources. And so that is, there is such a need right now to examine as to why our children, our youth are dying at such high rates. Since 2024, I know of 9 more. And that is just within the NAN territory. And these were unnatural deaths. So there is a need for us to have, this analysis, this research, and but we need to do it in a good way to ensure that we respect those that are not with us anymore. And when we did the review of children that died while they were in care of a child welfare agency, we had told the coroner that we wanted 2 grandmothers to oversee and be part of the review. And at that time we had Elder Stella Shimmons and the late Helen Camardi be part of that. And but I think maybe we need more than 2 people, where we would have some of the leadership also be part of, of sharing statements with the coroner, especially those communities where they declared state of emergencies. And so there has to be that inclusion process. And I want to thank, all the relationship and the work that we have been able to establish with the coroner. In the last 8 years, and there has been work. And so I just wanted to share that with the leadership. And we at Anishinaabe Nation will ensure that 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 we respect those that are not with us anymore, and ensure that we are part of a system where we can prevent more deaths. Miigwech.
Miigwech, Deputy Grand Chief.
Okay, thank you, Deputy Grand Chief. So now we're gonna go to Chief Archie, Chief Dolores, and then Chief Sylvia online.
Chief Archie Wabas, Waterman Lake First Nation. Before I recognize a youth on my left, on the resolution, I'd like to suggest a couple of options. I am not ready to entertain this resolution myself because I need community direction. I need a community direction. I'm not going to decide the family, if they're going to allow autopsy to happen on a child. What is our protocol? Like I have to respect that. So I'm going to talk to my people and get that direction. And also, that means if you want to table that until we get a clear understanding of the resolution, it will also impact the families that had lost their child. Yeah. And also, the other option is to put in the option of opt-in and opt-out for First Nations that want to be involved in this study or in this inquest process. You can include that and entertain it on the floor with that option. Opt-in, opt-out, if First Nations want to join, the First Nations can join, yeah, but not one of them until I talk to my elders and my people. Yeah, I would like to recognize Ramon, a youth speaker. Yeah.
I saw sweat go down Adam's head. Just joking. Wache, Ramon Katakwapit, Nishnakasun, Arobskat Doshtin. Hello, I'm Ramon Katakwapit. I'm from Arobskat First Nation, and I'm a part of the Oshkatazak Youth Council. And first, I want to acknowledge you because I can feel the heart, the warmth, and the empathy from you reading this over. But the one thing that came to me while you're reading this report, doing what you're able to do, is that these 62 people, they have names, faces, families, loved ones. One of them is my best friend, passed away in 2019 from suicide in North Bay, out of reserve. His name was Carver Sutherland, and he was 17 years old. And he dealt with these inequities that's on this paper. And during that time, I could have been one of these numbers when I was 18. A lot of this pain is so very real for our communities, and I understand that you're doing as best as you can. So if there's a way to, when you bring this information, to bring who they were with it, with the family's consent in any kind of way, or to hold an honoring song, or to make sure you have space for people to speak like you're holding with us now and not cutting people off. Because I felt that pain here. As soon as I read that number, I thought about my best friend. I thought about myself. I thought about my other community members and people that I've known that have passed away, whether if it's from the inequities through substance overdose or through suicide. The one thing that I want to see changed, that I know that we have people in this room ready to do that, to work, is this youth council. It's me. I know that if we're given the chance and the funding to go to reserves as much as we can, to go to our city hubs and just to meet with the youth and hold space with them, we could help them. We can help them feel seen. Because I'm an example of NAN holding that space for me, my first youth gathering. Before I was on this Oshkaraza council, there was space held for me that made me feel seen, that helped me understood the things I was going through and dealing with my own trauma, with my own substance addiction. And a lot of the youth that we meet now on a youth council, especially at the annual youth gathering, they share these things with us. They carry that pain. And it hurts to see that. But those of us on a youth council, the reason why we push so hard is because we know we could be there for them. I want to see that support from NAN to provide more funding so we can go to communities. I know that we can touch hearts. I know that we can help youth. We've been doing it through any avenue that we could outside of the youth council, outside of NAN. The very people that are ready to work here, we're sitting right here, fighting to be heard so that we can go do things for youth that are experiencing the very things that we grew up and experienced. That's what drives me, is to be an older youth that I wish I had in my life, that I wish would have held space for me, that I wish would have seen me and helped guide me, because youth, working with youth can really make change. But we can't do that with barriers. We can't do that with walls. We need help making these pathways. And that's where we could understand that the most at-risk youth, we can do things for. I know that we're doing what we can already with the capacity that NAN has, but we can always grow. And we need support on that matter, because I was just handed a paper of how much funding cuts have came for our communities here in Ontario with the yearly budget review. That doesn't show good partnership. That doesn't show reconciliation or reparations. That's a damaging, toxic relationship with the government. So where those funding dollars, to them, it's just statistics. To us, it's our lives. It's our family members, our communities. We're ready to do this work, but we need help on that front. And I really thank you for being one as leading as an example, one out of many that do not. So, Miigwech.
Miigwech, well, you've touched my heart. Miigwech for that.
Thank you, Ramon. So I'm gonna now go to Chief Delord.
One quick comment
Okay.
to the chief.
Sure.
Chief, this resolution is not speaking about the future death investigations. It's about the youth that we know, and I still hear exactly what you're saying about your community. I just wanted to make sure it's not, it's not about the future work. So just, but totally hear what you're saying otherwise. Yeah, Miigwech.
Chief Dolores, and then we're going to go to Chief Sylvia online.
Good afternoon. Getting, just want to say thank you for your presentation and your stats. I have many stories I could share too, but so I was just thinking with the stats what you shared with us, the 62. I know there's many more from 18 to 40 that are not a part of this report. And we're losing young mothers, young fathers at an alarming rate as well. And a lot of it has to do with mental health, drug addiction. But, you know, when we try and help our young adults using, say, we tried using BANREP to send families, individuals to detox centers, to treatment centers, ISK turns around on us and says, no, you can't do that. You can't spend money on addictions. It's like they hold us like puppets on what we can do. We know what's good for our community, and yet they hold the strings, which in my opinion is a real piss off. And you know, you need healthy parents to have healthy children. So that's where, for me, that's where the root is the parents. How can we have healthy children if the parents aren't healthy? And then again, it's ISK who controls what, you know, the programming dollars. They have to see reports, they have to see, we have to live to their expectations, which is not, you know, there has to be some kind of change, especially with ISK. ISK is our problem too. And and you know, yeah, I'm going to tell you one story that still bothers me today. It happened a few months ago where we had a couple in London, Ontario for medical. They took their baby needed surgery. And while there, the mother committed suicide in the bathroom. And we sent the whole family to London. And while they were there, as more family was arriving to unplug her, the doctor went and unplugged her with nobody present. And that really, you know, that was a traumatic experience for the family. And today they're still, you know, they're real ticked off that they weren't there when, because the norm is family is there when you unplug, when they're brain dead. But to us, they're alive because we can still feel them, they're warm. But the doctor pretty well just said, well, she was dead already anyway. You know, that's not a way a doctor should proceed with, I don't know, maybe he didn't know our culture, I don't know, but still, that does not sit right. And yeah, I just wanted to share that. And you know, it's so hard to come by treatment centers to send our children, our youth, our young adults, and that's where these suicides are coming from, despair. And and yeah, that's I wanted to share that. But I also have one more comment. I was told before that when there's an autopsy done, the coroner pays the charter back to that home community. I don't know if that's correct or not, but I know it's been done a few times. But it's such a long process, like for the offices to work together and pay some of the charter, because they're the ones who brought them out. And usually we just end up paying everything because we can't wait. Is there a reimbursement process? Is there some kind of with the airlines, do you guys have that you guys can say, okay, this amount, bill us this amount type of strategy? And yeah, it would really help us out because we face so many deaths almost every week. And it's really sad. And personally, I've experienced it too. And it's not something I would wish upon anybody. Thank you. And one more thing, I want to recognize Rachel and Schnaba.
I just wanted to make a few comments, especially like I know Chief Taylor brought it up about like treatments. I know that, you know, like I worked for a treatment center for a while, very underfunded for about 8 years. I know there's a big freeze, like we're only allotted to pay our counselors $20 an hour, 50 cents for a kilometer. I just got word from Ken that it's up to 65 cents an hour. I mean, 65 cents a kilometer. I don't know if the freeze is still on hold, but we're like, I know when I worked at the treatment center, it was like a sinking ship that I received. And like, so you have to go and look around for money to pay counselors at least $45, and those counselors wouldn't stick around. So, and you can't get a new building. You need to have a building that already exists, but our buildings are being used in community, right? So there's just so many roadblocks for us to help our people. Like I work for my community of Sandy Lake under Mama Wichiwell and Band Rep Prevention, post-majority care. I have my background in mental health, and that's, you know, that's the biggest piece is our young people are dying, yes, because of like sexual abuse and different kinds of abuses, but it's mental health. Like I had to fight for my daughter. She's diagnosed with bipolar, and it was awful. And it's like I had to wait for a non-Indigenous, I mean, you know, in Thunder Bay, I just feel like they have a little bit of a bias. I had to wait for somebody from Toronto to come into Thunder Bay, and she was taking over for 3 weeks. In that 3 weeks, I was blessed because she said, if I would have seen your daughter's records, you know, if I would have seen your daughter's records, I would have diagnosed her at 8. And she was 22. And we're at the hospital every day, like almost every week, like, and I can't imagine, like, I always tell young people, you have to advocate for yourself, even if you're in child mental health, like tell them that you're not feeling well, and, you know, there's no diagnosis or misdiagnosis. Like we need additional help. That's what we need. And that's all I really wanted to say. You know, there's this, and I need people to understand that, especially for treatment centers, our people there, it's so underfunded. Like you can work at freaking Tim Hortons for $20 an hour. Like no counselor's gonna work for you for $20. Like maybe it's gone up since I left 5 years ago, but it's not gonna go up that much because like there's a cap from the federal 8 years. And I had to always look for funding for treatment center, for a family treatment center. And for the children's treatment center, it was covered, but you had to put your child into care, you know, and those are barriers for families to be healthy, to get adequate diagnosis for children. Like we're paying $3,800 from our program so a child can get diagnosed or start a diagnosis process. So I'm just going to leave that here with you guys. Miigwech.
Miigwech for sharing, and again acknowledging that we deal in tragedies, and we're bringing numbers about as you talked about your best friend and how this is so real for so many people. And I'm not, I know I talk numbers, but it's, you say we want to hear those voices. We want to hear your best friend's voice and bring that voice forward in a way that's going to be meaningful, respectful, and hopefully help to inform prevention, but also inform response, that when people are unwell, not just prevention, but also that response. And example that you provided of a safe space and hearing from the youth council and working together. So some ideas that are the kinds of things that we're hoping to inform, not to deliver, because it's not we don't do that work, but that doesn't mean that we're not going to hear those and bring those forward. So miigwech for sharing, and again, acknowledgement of how the conversation that I'm bringing adds to the heaviness for everybody, and recognizing and apologizing and hearing. Miigwech.
Okay. So now I'm going to go online to Chief Sylvia Kostachin. Your hand was up earlier, if you still wanted to speak. Okay.
Yes, I'll try to keep it short. What you, Sylvia Kostachin, Matadwa, Banin, Hassan, Adobe scheduled the statement, Okamakan Maganina. Nanask man go today, Nishagishagak, Mina, Wabatamach, Mr. Cabbage, which I Kasaga Haganano. Kashista, Mr. Madison, Madison. Thank you for the report. And this is and thanks to all the speakers, all the chiefs, especially like to acknowledge our youth, Roman. And this is just one of many that our youth are going through today. It's a very heavy topic. Not only our youth, but a lot of us, we never really used to talk about mental health growing up, but we did carry lots. And as time went by, there was some safe spaces that was created to talk about really what had happened to us and what's still happening today. And I hear a lot as being chief, we hear lots. Our work is 24/7. And sometimes it is really heavy to carry. Most times you feel alone, that you are working alone, that you're doing this job alone, because it just feels sometimes overpowering. But at times, for me, what helps is knowing that I am a strong person. I am a strong lady, because I've been through lots myself, and that helps me, and especially having faith, and especially turning to my higher power as understood, and placing those burdens on him so I don't have to carry it alone. And it helps. I'm just sharing. As chief, it's hard, and we need that release when we work with our communities. At one point, this resonates with me. This one tragic loss we had in our community, and there was a young lady. She was pregnant at that time, and she was going to Kingston, and that's where they send from Arobscut. They send out their people or women that are expecting to Kingston General Hospital. And something happened to her, and she was struggling with addictions. And she was at that hospital, and I guess she had taken something. Then the next morning we hear she had died along with the baby. The baby had died too. And I think about her because it was the first funeral I couldn't bring myself to go up front because I couldn't face her and the baby in a coffin because there was and she was carrying her baby. And had somebody said something that she was using while carrying a child, that baby could have been saved too. And the mother, she had asked, she's looking for answers. Even still today, she carries this heavy burden, loss. She comes to me. She often comes to me. Is there something that could be done? I want an inquest. I want to find out what really happened to my daughter. So we did make an application, and the application came back. And the coroner said, we knew what the root cause was. And it says the inquests are so backlogged, it would have taken years until we get to her case. That's what we were told. Then we decided at the regional level, we were talking to a lawyer from Mushkegowuk, our tribal council. And he said, why don't we do a collective approach? Because there's so much loss in our community. And we often talk, like in our area within the Mushkegowuk territory, and I know a lot of them had declared state of emergency on addictions. And they had requested it. And again, it's almost the same message that the mother had got, because the mother is just looking for answers. And it says, she said, I don't mind if we do it that way. That would help a lot of our members really finding out exactly what's the real, what is, how they died, what are the causes, what happened, what did they ingest. And so many times too, when we send out our community members that pass on for autopsy, it takes coroners, it takes forever just to get a report back. Just the other day, it was 1 year anniversary of a young guy that had passed on from overdose. He ingested, yesterday, the mother released on Facebook, or the father, saying that they got the report that said he had taken 4 kinds of deadly drugs. 4 kinds. He ingested it, and he passed on. So what I'm saying is that there's so much declaration, and we know that there's a lot of age groups we're talking about. There's, and even people that are getting adults, older adults are taking drugs because they become addicted to these painkillers, and they go out and find them. They go out of their way to take them. And a lot of the deaths are attributed to a lot of different factors, but along the way, it's not their fault too. It's also the doctors that are easily prescribing all these medications. And that's what we're trying to find out, is that, yes, there's a lot of death, because we do need stats, but we're hearing a lot of hearsay about their lifestyles. And it's a very, very sensitive area. But at the same time, we need to move forward and heal. We need these venues, safe spaces for them. And it's true, and I heard it from the other chief. There's these systems at play that's supposed to help us, that we're being challenged and struggling to get access to, especially if you're in the remote north, working under the hospital and the mental health, or farming a lot of our members through their families. That's another story. And I've been hearing this for a long time, and it seems like it's not getting any better. it's a topic of the day, and it's not. Next year, it's goes underground, the following year service again. And a lot of there's a lot of needless deaths out there. And we got to do better. That's what I'm saying. And I thank you for your report. And it's true, those numbers have names. And it's the work that we have to do in honor of them and and those that are suffering. So I know from our end, from Michigan, like the corner we deal with, Sapri, they try to prioritize people from where their locations are at because they know that they have to, they know that living in the remote north, we have challenges, so they try to prioritize some of those cases. English, Bundan, that's all I just wanted to share too, because I think about that child, and there's a lot of our young women that are pregnant and using, and addiction starts. A lot of these addictions starts when a baby is born, and yet we can't seem, when we know that person, that woman is using, and yet that baby inside that womb, most time when we report it, we can't do anything about it because they said, well, the baby doesn't have rights yet because he's not born yet. And it's sad. English, budget.
Miigwech for sharing.
Okay, so we are going to go to Chief Gary and then to Grand Chief for closing remarks and then get into the resolution.
Okay, bonjour, Chief Kuzis from Nishkandaga. I just want to share, there's one youth that's in ICU right now due to a attempt of suicide. So this happens regularly, like and the family is asking for a prayer. So I just wanted to share that. So, miigwech.
Miigwech, Chief. I'm sorry that that's happening.
Okay, so we're going, for your request, Chief Gary, we will be having a prayer after, because of the topic and the many that have shared, that it's important to close in a good way. Miyagesh chigeng, jinigibay gang, at the Terry Tanona Agni chigibay getpi. So I'm going to go to Grand Chief Alvin for closing remarks, and then we'll get into the resolution. And thank you so much for Kagagitek. Very important.
Miigwech, chiefs, and Dr. Heyer. As difficult and as painful this conversation is, it's a necessary one. I just want to acknowledge your own pain that you've shared here this afternoon. It's important that we do this work, especially here today, this week, as we begin to prepare ourselves to take back that responsibility and that authority to raise and look after our own children. That we need to take a look back on what's happened and to collaboratively, through a collaborative process, working together to examine that very painful picture that we know it's there. I don't think there's anybody here on the table that has not experienced a painful loss. And I think that's the work that Dr. Heyer, through his office and the capacity that he has to work with us, to begin this work. And I think that is all we're asking for here today through this resolution, is to begin that process. What will that look like? And how do we ensure that we honor those, especially young people, the youth, the children that have left us, to remember and honor them? And it really hit me when I traveled to Kingfisher Lake a month ago. There was a small team of us that went there. The community, the chief and council asked us to come there because they wanted to talk about a community healing plan that they want to work on. And the meeting was held at the community hall. And I remember walking in through the door, and what the first thing that you saw when you walked in were pictures of their loved ones that they've lost over the last 40 years. Young men, young girls, some as young as 11 years old. And they made this effort to go back and make posters of these kids. And they were on the wall with their names and the year that they died. And as we sat there for that whole day talking about how we can support Kingfish Lake and in developing their wellness plan, you couldn't help but think about the loved ones that they've lost, because they're right there on the wall. And I think that's what we are proposing here, similar to that approach. That we need to go back over this 5-year period that is being proposed to paint that picture on the wall, so that when we do this work, that we will not forget them. That through the ultimate loss, the sacrifices that many of our children have made in losing their lives, that their death cannot be in vain. And that is what we are asking you here today, chiefs, is to begin that work. But we will not just go off and do this by ourselves. We want to involve the advisory councils that are here with us. And maybe it should be led by the youth council, as one of the youth delegates, Ramon, mentioned earlier. That it should be them that will help guide this work with your support. And I'm hoping that you will consider what is being proposed here this afternoon. That we need to, and I don't pretend that it will not be without its challenges. It will be hard. It will be difficult. But I believe it's necessary. And we will come back to you once we've developed a more structured process how this will happen. We will come back to you in July for further, just a check-in. And if we are doing it wrong, then you can give us that feedback, and to making sure that we do it with respect, that we do it right. And so I just want to say miigwech to everyone that spoke here this afternoon. I'm not sure if Chief Nakwaji, if you wanted to add something. But I hope you could consider supporting this, because I believe that it's something that we need to do. So miigwech.
Thank you, Grand Chief, for your closing comments. So now Adam will present the resolution to the delegates.
Miigwech, Connie. You have your microphone on. Did you want to speak? Go ahead, Chief Nakaji.
Okay, thanks, Grand Chief and Alvin. Chief Robert Nakaji. I like the idea where the youth will be leading. I really like that idea for them to lead, and hope to see them in my community soon. Thank you.
Miigwech. So we have the resolution. Before I deal with the resolution, I just want to say some of the discussion, a lot of the discussion has been very heavy. And I'd like to thank the chiefs that shared very personal and very difficult topics that are being dealt with. So as part of the, on the agenda, we did not have a closing prayer. Usually that's done at the very end, but we will have a closing prayer. Also, Elder Terry has worked with the Youth Council. There is a smudge going around the room for those that wish to participate with the smudge. So that's happening right now. And we will end the day with a prayer. So there is a resolution. There's been some suggestions on the resolution. I just want to make note, we're very close to quorum, so we're monitoring that. So please, let's deal with this. I'll see you if you're standing in the back there next to the mics. So there is a resolution. I recognize that Chief Wabas, you had suggested either tabling it to a future assembly or sort of putting in an opt-in or opt-out clause. In looking at the resolution, nobody is locked in necessarily. So the recommendation I'm hearing is that we do proceed with the resolution and that you do take the time to go back to the community and the families that may have been involved and have those discussions, but again, nobody is locked in. So the recommendation is that we do proceed if we do have a mover and a seconder, and if you wish to proceed with the resolution. So that's the recommendation that I'm hearing. Also, the last comment in involving the Youth Council with the work that would be mandated. So if you look on page 2, I'm assuming you have the resolution. If you look on page 2, further be it resolved, the middle one, it actually says NAN Chiefs and Assembly mandate NAN to implement this resolution by engaging with established NAN advisory committees. So that does include the Youth Council, the Ushkatazag Youth Council, the Elders, and the Women's Council, and also the Chiefs Committee on Health Transformation, which I was actually very glad to hear that there is a member of the Ushkatazag Youth Council on the Chiefs Committee as well. So that would help with that, to have the youth participate and be involved with that. In a resolution such as this, you don't necessarily get into the details, I don't think, in terms of how it would look and the specifics, but that's a consideration. So the resolution is here. Chiefs, are you willing to move forward with the resolution? And if so, I'm going to need a mover and a seconder, and then I can get right into it. So you're willing to, no, okay. Proxy, how?
Yeah, just Rodney from Poplar Hill Proxy. Just have a quick question and brought to my attention from my friend Chris back here. Halfway down the resolution, whereas, can you explain to me who the Indigenous Child and Family Wellbeing Agency is? I understand the Children's Aid Society, which could be Tikanagan, Kuno, and whoever, But I guess the issue brought up was that because some of our First Nations are taking over post-majority effective April 1st, we want to make sure that the First Nations are protected in this or mentioned in that. So can someone explain to me who the Indigenous Child and Family Wellbeing Agency is? Thanks.
Migach, I'll turn it over to Dr. Heyer.
Those are the agencies such as Tikanagan that have been in the Ontario, the land called Ontario model, which agencies were supported. So Nagda-Windaman, Tikanagan, and other agencies. So it does not specifically, because they fall under the mandatory reporting of all deaths, where an agency, either a Children's Aid Society or one of the Indigenous agencies suffers a loss of a child, they have to call us. So that's the reference.
Chief Matthias.
Budget, I'd like to move the resolution.
Migach, do I have a seconder?
Chief Robert, a second.
Migach. Okay, so there is a mover and a seconder. So we'll bring it to the floor. Does everybody have a copy? I want to make sure you have a copy so I don't have to read the whole thing. Anybody not have a copy? Okay, so I won't read the entire resolution, but it's resolution number, sorry, can you scroll to the top on the screen here, just for my sake? Okay, so it's resolution number 2605. It's titled Anishinaabe Nation's Strategic Approach to Working with the Ontario Office of the Chief Coroner, Child and Youth Death Review and Analysis Unit. So we can scroll down. The resolution reads, therefore, be it resolved that NAN Chiefs in Assembly recognize and support that learning from these tragedies can contribute to the improvement of child and youth health and prevention of further deaths of young people in NAN territory. Further, be it resolved that Chiefs in Assembly mandate NAN to implement this resolution by engaging with established NAN advisory committees and the Chiefs Committee on Health Transformation, which has begun the important work of data management and First Nations data sovereignty as they relate to health within NAN territory. Further, be it resolved that Chiefs in Assembly mandate the NAN Executive Council to work with the OCC and CYDRA to develop an approach or approaches to share the information that respect the loved ones' stories, are of collective benefit to NAN communities, are actionable and can inform implementable changes in the short and long term, are transferable and can be replicated for other death investigation data if required. Dated at Toronto, Ontario, this 25th day of March 2026, moved by Chief Matthias Anderson, Casablanca, seconded by Chief Robert Nagaji, Fort Albany. So we got the mover and seconder. It's on the floor. Mover, it's not required. And we've had a really good discussion on this already. But mover, if you want to speak to the resolution. Are you okay? Okay. Seconder, Chief Nagaji.
I'm gonna hold everybody from supper. No, I think it's really important to follow up and follow through some of these things because in the report that was given today was some alarming. And again, I just want to repeat, we got to get to the root cause. Yeah, thank you.
Migach. Floor is open. There are any comments, questions, discussion? Checking online as well. Second call. Proxy Howe, go ahead.
Yeah, it's Rodney from Poplar Hill. Our First Nations have suffered, Poplar Hill has lost a lot of children in Tikanagan's care. And we're still dealing with that trauma. And I thank the Deputy Grand Chief Benny for helping us. I still don't know if my question was answered. Because I want to make sure that effective April 1st, some of our First Nations that have taken over post-majority for children effective April 1st, if those children die, I guess the coroner's office will be dealing directly with the First Nation, not the agency. I also recognize, because I worked at Tikanagan for over 20 years, read many death reports. I just want to make sure that the chiefs understand that when you take over, and I want to recognize the youth that brought this up yesterday, that we need to make sure that we understand as chiefs that we're taking on that responsibility. It's never left us. It's always been there for us. We need to take it back. It's never left us, that responsibility. So I want to make sure that this is reflective of that, because my friend brought that to my attention. Thank you.
Very good. Proxy Howe, I just want to make sure that we're on the same page, just so that everybody understands. And I wasn't sure if Dr. Hyra was aware of the other dynamics happening right now. But previously, it was the child welfare agencies that was responsible for everything. Moving forward, that's changing, and the First Nations are taking on a lot of that role that the agencies took on. So you just want that recognized and some clarification. So, Dr. Hyra?
Miigwech for that, asking for that clarification again, and I apologize I didn't make it earlier. If there is a death in the future, and I'm hoping there won't be, but if there are deaths in the future, we would work specifically with the nation, and we would develop the review process together for that individual death.
So this resolution deals with the past, the deaths in the past. So, Proxy Howe, are you okay with leaving it as it is? Okay, you're good. Chief Naguji?
Hey, just on further be it resolved, can we add making sure that in one of the bullets or in there to have the Oshkatisik entered into the further
Okay.
be resolved?
Actually referenced in the resolution.
Yes.
Okay. So I'm going to look to the resolutions team. I know there's a reference to the advisory councils in the second further be it resolved, but maybe a further reference to emphasize the Oshkoshag Youth Council. So we'll get the team to work on that, and we're going to speak to it first. Okay.
I'm going to recognize.
Okay. So while we go to Cohen, the team will do that, and then I'll come back to you, Chief Nagaji. Go ahead.
Okay, I just wanted further clarification. So we've heard that the Oshkoshag is requested to be a part of the planning or developing a plan for this. So in the second further be it resolved, we would be more of an advisory council and giving our thoughts and opinions. But if we were to be involved in the development of the approaches, would we be included in the third be it resolved? And so, yeah, could we be added in there along with the NAN Executive Council?
Good. So I think the resolutions team had something, but I think what I'm hearing is the third further be it resolved. So where it says mandate the Executive Council to work with, and then you would add the Oshkoshag Council, comma, then what we have there, the OCC and the CYDRA. There's also the reference to the Oshkoshag Council in the second bullet. I have to be careful. As co-chairs, we're not actually to give the wording in a resolution. So that comes from you, Chief, and your designate. Chief Nagaji, I don't know if you can see the screen in the yellow. So in the first further be resolved, where it talks about within or with the established NAN advisory committees, including the Oshkoshag Council. That's the addition, but it sounds like there's a further request. Be it resolved. Mandate the NAN Executive Council to work with the Oshkoshag Council, OCC, and CYDRA to develop, etc. Chief.
Miigwech, thanks.
Yeah, that's good. Okay. Mover, are you okay with that? Yeah. Seconder? One thing in seconder. Oh, yeah, you're, you're obviously okay with it. It's been a long day. Any more comments, questions, discussion? Any more comments? Chief Wabas.
Thank you, Chair. Like I said before, I have a responsibility to work with my people and to get their direction. And this matter is kind of sensitive to me and to the families that lost their loved ones. Using that information requires their consent. So that's what I need to make sure. If this goes through, and all of a sudden, there's a letter that came from coroner's office about the death of a child, and they're going to be wondering what is this? How like why are they looking at the information? You know, I think there has to be a consent to the families that lost their loved one. So, that's I want to work with the families that were impacted or that lost their loved one. I need their consent. I need their okay, so I can do this. Yeah, that's where I stand. Yeah, thank you.
Thank you, Chief Wabas. So based on your earlier comment, I think you sort of mentioned an opt-out, Gishman. What if, again, I can't tell you what to put in there, but what if you have a clause in there that says any of the families, if they wish not to participate, they can opt out and not participate? Would that work? Okay.
I think that's the way to go. Like this is right down to the family's sensitive matters, eh? So you need to talk to the families first to get an okay to be part of the research, the investigation. Yeah. So like what Chief Quizzy said, we're going to reopen the wounds because we're going to be asking for the loved ones' stories and things like that. So, that's where I am. That's where I am. Like, this is their issue, not my issue. This is their matter, not mine. Yeah.
Okay, Miigwech. So we have up on the screen, you can probably see here as well. Finally, be it resolved that any family potentially involved in the research or investigation may decide not to participate. Does that do it? Okay. Mover, Chief Matais, you're good? Seconder is good? Okay. Last call. Any more comments, questions, discussion? I saw Chief Leonard there raise his phone. I thought he was gonna Mike's bodyguard.
Maybe we can use the word consent.
Okay, that any family potentially involved in the research or investigation may decide not to participate, but you want the word consent?
Yeah, consent.
Okay, I'm just gonna.
If you could rephrase it to you need their consent.
Good. Okay, so it says may decide not to consent to participation.
No, that's not the word I'm looking for. That's not the phrase I'm looking for. It's something like the families that are that have been impacted or involved. We're going to need their consent.
Okay.
We're going to need their consent in the research and investigation. The consent of any family potentially involved will require, well, actually, yeah. We have a lawyer here.
Okay.
Yeah, we do.
They're-
Okay,
They're working on it.
yeah, okay.
Are you okay with that one?
Uh,
There's a thought, a comment to
Okay.
consider.
Yeah.
Can we hear them?
no, I didn't hear him.
Okay,
Yeah.
we'll get Dr. Heyer
Yeah.
to
Uh,
give some comment.
Yeah, I'm not, like, I understand your concern, Chief. And I'm not sure if we maybe didn't explain it properly or fully. The data is already there. Like that 5-year period that the chief coroner has identified from 2019 to 2024, the data is already there. I think the proposed project is putting it all together. Like we're trying to, I think, equip our communities with information, with data, and we're trying to find a way to honor those that we've lost, like to respect, families, any sensitive information, for example. It will not be in that data, in that report. But I think it's to try to give some tools to ourselves for planning, for example, like as we, and I said earlier that I think this is timely, especially as we get ready to assume more and more authority over our own children through the child welfare system, for example, or
Okay.
health.
Okay, you know, the information that's there, and if there's no engagement, no contact with the family, I'm okay with that. And if you're gonna engage the family, we're gonna
Yeah.
need their consent.
Yeah, that makes sense. Yep.
100%, because we can't do things and talk about people without them knowing that we're talking about the details. So we have the information, and if we need, this is why I can't speak to the resolution except that I think it's very helpful, especially with the council. We want to be guided on what approach to take, and maybe the guide's going to be, if you do anything such, you must phone the family, but phone the chief first and figure. So all of that, I think, needs to be told to us in thinking about what is the best approach. But we have the information now, and you might, we have that, and we feel we're very troubled by the fact that we hold this information and that we aren't able to move forward with that information to start to take the steps to help with prevention. So we're very much struggling with that and wanting to make sure that we hear those voices and we bring those voices forward without causing trauma. And that's really what we're trying to do.
So will there be an engagement with the family?
We don't plan to do engagement with the
Okay.
family unless we're directed
Yeah,
through the approaches. And that's where I think
okay.
what Grand Chief said would bring back into July.
So we're just
Which I
gonna
think is August,
compile,
but-
so we're just gonna compile the data.
Yeah.
Okay.
Yeah, and I struggled with the word research as well, because
Yeah.
we're not studying the kids. We're trying to understand what we learned from the kids and bring those things together. But no, we're not planning on engaging.
Okay. Chiefs are my witness. Okay, I'll go with that.
Thank you very much for the question. So it's really helpful.
Okay, good. Okay, so where were we? So we're doing a final call. So you're okay leaving that out? Okay, leave that out. Thank you. Proxy Mike. Yeah.
Good evening. Mike Morris, proxy for Wagaboon. When you look at the time period, 2019 to 2024, I lost two of my grandchildren during that time. So what is this gentleman going to be doing? Is he going to be not telling my daughter, what my daughter and son-in-law, what he finds. Is that the way it's going to work? Like, I worked hard. The mother has worked hard to heal the wound of losing two children. And I don't want anybody to come and open those wounds again.
Yeah, Miigwech, for your expressing that real concern that I'm sure a lot of families have, but that's not going to happen. Okay, I think what the chief coroner and the discussions and the planning so far that's gone into this, I think we're guided by some real fundamental values, and one of them is this respect, especially to those that have lost loved ones. That we will not go and probe and try to find out, sensitive information. So I think that's something that we will make sure that as this work proceeds, that it will not cause further harm to those families that have lost loved ones.
Miigwech, Grand Chief. So I don't see any more comments or questions. Proxy Howe, go ahead.
In my years of experience working for the mother agency for such a long time, I struggle with even casting a vote on this. The reason I say that is the mother agency has never, ever said sorry to those families that lost loved ones. So I have a hard time without asking our First Nation people whether or not they even support this research. Once again, I know what happened here in Thunder Bay, for example, with losing high school kids. I know the trauma that our families went through, still living with that, being re-traumatized to talk about that, especially when the news people come and want to talk to their community members, families. I don't know where this research will really go, but I think at this time I can't vote on this. Just because also how the mother agency has treated our families.
Miigwech, Proxy Howe. So just a reminder, chiefs, you all know the process when we go to a vote and you choose to abstain. It doesn't mean it means you vote neither for or against the resolution, that you're not voting on the resolution. That's what it means when you abstain, and sometimes you explain why you're abstaining. And if you choose to abstain, I think we hear you. Everybody hears you. So miigwech for that. So with that, the resolution is before you. We have a mover and seconder. And so I'm going to call for question. Resolution before you. Is there any opposition to the resolution? I'm looking online as well, and help me out. I see no opposition. Is there any abstentions to the resolution? I see 4 abstentions. If you wish, we can just say there's 4 abstentions. But if you wish your First Nation to be actually noted on the resolution, we can do that. Raise your hand if you want your abstention noted. Thank you. So that's 4 of you. Raise your hand again just for note takers. Did you get that? So it's Deer Lake First Nation, Wawagabiwan First Nation, Aaron, Fort Severn First Nation, Webekwe First Nation, and Poplar Hill First Nation. Miigwech. With that, based on the total numbers, resolution, I just want to clarify, do a quick count, that wouldn't be more than a majority, right? And we have, okay? Okay, so we do still have enough. So the resolution carries. Thank you very much. The resolution is carried and the executive will take that, that mandate. Okay, it is 6:17. We still have the Chiefs Open Forum. And I know, Chiefs, we didn't get to that yesterday. It's 6:17. There is a window, there is on the agenda, Chiefs Open Forum for tomorrow. But one of the things to consider, we can keep going. One of the things to consider is in this discussion today, I want to thank you all again. It's been actually, you've dealt with a lot of serious issues that need to be dealt with now, today. And I think a lot of these issues are issues that you would have brought forward in the open forum. Things like the struggles we have, the epidemic we have, the mental health crisis we have, and very open discussion on things like sexual abuse and challenges like that in our communities. Those have been talked about. So I know that a lot of the open forum things that you wanted to talk about have been dealt with here already. And also, just to let you know, for health transformation tomorrow morning at 9:30, it's actually the first agenda item on health transformation. What they're going to do is do a quick overview, and they want to focus on immediate needs, immediate health needs. And things like NIHP, the NIHP health transportation problems, that has to be dealt with not later, now. What was the other one? There was another health, the addictions and mental health crisis. That is something that needs to be dealt with Shemak now. So there will be an opportunity during that health transformation discussion. Okay, I'm just getting a bunch of notes. Chief Gustajan Mataroaban has her hand up. I'll come to you, Chief Sylvia. But there is an opportunity during health transformation to talk about those immediate community concerns. I just wanted you to be aware. So there, it has happened already, and it will happen again tomorrow, and there's an agenda item for a community open forum. So, but my question is, do you want to continue or do you want to wait until tomorrow? Chief Taylor, you may not have heard me, but during health transformation, we're going to talk about immediate needs, things like mental health and addictions crisis. So, okay. Okay, I'm hearing tomorrow. Okay, so with that, I'm going to go. So chiefs are in the room. We're going to start to wrap up, but Chief Gustajan Mataroaban, go ahead.
Hi, good evening. I know it's a long day, but there's something that's been on my mind. I'm thinking about my fellow neighboring community, Quechua First Nation. And I know for Chief Jose and his leadership, it's been hard. And they lost like 8 people since the community got evacuated for their water situation in their water plant. I know there's a lot of discussions that's been happening at the political table, but we all know the systems have played that we could only do so much. But it's a similar situation where I'm at in Alapska when it comes to infrastructure and water. But I've been dealing with it. We've been, as the leadership, been dealing with it, and it's slowly progressing. But at the same time, it has to do with ensuring that the funding that is needed to build up to capacity, and that's and the staggered approach to how they fund our infrastructure and water and wastewater is crippling our whole nationhood. And we know there's a lot of investment needed in infrastructure and water and wastewater. We're at different levels. When I look at my community alone, we did it in an analysis. What would it take to build out Obiscud? It's a lot of money. Last count was 500 million. So I'm thinking about cash, and what I want to know is that we should be rallying around communities that are really suffering. And that are like, there's a lot of ad-obs, and I keep saying this, there's a lot of ad-obs out there. And my neighboring community, Cash, has been going through this evacuation year after year, like spring's coming up. and they're displaced from their homelands and harvesting is coming up. You know, like this shouldn't be happening. And that's one thing I wanted to talk about is that that's not acceptable no more because this government, both levels of government are after our resources and our lands. And they threw that, taking up costs on us. And we know we know who this land belongs to. And I'm tired of it. And I keep saying that. We got to do better. We got to help our people that are suffering. Our people are literally dying. And I just wanted to put a note on that because we should be rallying up after our communities that are really struggling. Mingash, I'll leave it at that. Something to think about for tomorrow. Mingash.
You got, Chief. So I know tomorrow we'll have ISK Minister, and you can think about this, how you want to take a collective approach to stand with the First Nation in their struggles right now. Hey? Yeah, I had already closed it, but since you're my friend,
Fine.
Mike
No.
Praxi.
We have our big sister here in the hotel attending another meeting. She's been updating me on the baby's remains were found this afternoon. Our achievements grandson. I don't know if there's where he's gone. Cornelius, kita give us again. Kaya go negas kitugan nagtayo sige.
Okay. We do have an elder. Terry is about to do the prayer, but if you're asking Cornelius Gawin, Kishpan Gawin, sige pan. Kanondona Cornelius. Kishpan sige. Igamayamen sa stog, tapos ko jugo igim kuwaganot, awaz, pinmao gawin daman. While they're having that discussion, if we have the prayer, we will also have Terry do the prayer. There was a request from Nishkandaga. It's very difficult when we hear what we just heard. That's no kanon daman, Mike Morse. Mike, no gumnabugawin damagwin. Me is no daman right now. There might be a connection to Round Lake as well. There might be a connection to Round Lake. So mi maga da zugumakanot benma ewin damons. So we have smudged the room. Cornelius Kishpin Kagashktuna James again. Okay. Egwashko I am Chigate Cornelius. Mino at Danyam Chiganon. I will also invite Terry to come up also.
Okay. Iskem ko isege gunam nunukuan ando de bukokayan ego deshe kugwe kagwe tudaman ko micheminige tudaman wegan ganunukuan we tukuchtoan tudaman we siskutak kegun Can you know round ligayang? Kaya gunagunde at still semen. May God's basic in the bin magan. I think Thunder Bay. The Elk family. I would see my with Gamadewats. Eknob Mawats, Utan Swan Mountain. I think it's a girl that attempted suicide. It was parents and your mama has to make that decision to take that machine, unplug it, and biggest sin we need to do think. Amisha is young with so many gun one. Oh, yeah, Donnie Morse. Count has son. Hanman nagab me touch. When they get big, and the queen nagab me touch. A good, which is a good stone, which is good man. And then I know go book Kas Mojid Nanong. It's back in the Magian. Ekumina Kska Komanaga Mojid Nanong. Which is much stone. Manduga Gajwadzen. Na damun dagun the pagan gas sick. Went with them on Donnie Morse. I was got me do Chuanum son Usanga Gaguni Hatch. Egumin going to get Gimaga watch the Ben Maganek, Egumina, you have booked in Mexico. Gimaga watch and Snook. The Mamma Dunin and Mamman, Homaga, Bintigamanga, and Mauchidia. Tigusha Namada. Egumina. To give me the door better than one. Egumina with the Uma Thunderbega Adza. Kamade Watch family. I mean, because go in the moon. Because go in the moon. Kamade mute watch. Tapos ko tas the naked scap can watch. You know, Gasaki watch, Kagano watch. This is books in Manan Mando. Tiki see the door. Tiki shon da. Women watch. Gas watch. Mama Bokas young. Watch Kagayang, Pintigaman got the bench again. Kagwits and Mago Chigi, Kishon the young. You know, to show them shank. You're going to come to watch the Ben Map, Nanak, New Jogananak, New Jan Snanak, no Snanak. Chukun my dog. We got the book. We got the bench again. A mere book send the man Mando, and they're going to eat shank. Kagwits and Magon. Take it to Magan shank. We got an action. It is your man. Get the scars on the James Young at the bench again. In Jesus' name I pray. Amen.
Miigwech, the elders have advised me that will be the closing prayer for today. So, Miigwech, Cornelius. Thank you, everybody. Get some rest. It's been a good day, long day. We'll see you tomorrow at 9 o'clock. Miigwech.